According to the Chief Executive Officer, Focus 1000, Mohammed Bailo Jallo, the week-long visit, which began in Bombali District Health Management Team, DHMT, and to communities and several health centers within the districts of Kayene, Kwenadugu, and Falaba, aimed at not only assessing the static campaign, which gears towards strengthening the fight against malaria, tuberculosis, and HIV and AIDS, but also to raise awareness about the prevention measures of the three diseases. Malaria is said remains the #1 killer disease for children under 5 in Sierra Leone, accounting for 25% of the under 5 mortality rates in the country. Hence, strong community engagement, testing and treatment plays an integral role in the reduction of the disease.
If you are tested against malaria, you would know if you are infected, and if you are infected, you are going to be treated. If you are tested, for tuberculosis, you would know if you are infected, and if you are infected, you are going to be treated. If you are not infected, that is good. Also, the same thing with HIV/AIDS. If you are tested, you know your status, then that is a plus. If you are negative, then you know you are negative. But if you are positive, now you can go forward for treatment. And the good news is that the treatment is free, and the treatment is available at community level.
Alhaji Mohamed Moimara, who is the town chief of Senekedugu in Kwenadugu district, and Ibrahim Bangura, one of the councillors in Bombali district, described the static campaign in their communities as a life-changing moment, noting that before the advent of the campaign, they have recorded huge number of malaria-related deaths. They said that measures have been introduced to ensure that their subjects take the malaria vaccines and use the mosquito-treated nets for the right purpose when the mass distribution commences by the Ministry of Health and Sanitation. The willingness to test for various illnesses shows a strong community outreach undertaken by the Focus 1000 district coordinators.
They are willing to test, and more especially we are with the drugs when somebody is positive, so we can treat the individual.
If you want to eliminate malaria, you need to take down key messages for the people to understand. You make sure you communicate with their own language that they do understand, so that they will have all the knowledge on how to prevent themselves.
It is expected that before the end of the static campaign, which is being implemented in each district of Sierra Leone, there will be mass reduction in the infection rate of malaria, TB, and HIV and AIDS at all levels. In another development, the Chief Executive Officer visited one of the Kombra Media Network farms in Kayene district and traders in Makeni who are currently engaged in the Kombra Savings Loan Scheme. SLBC News, William Wise reporting.